Welcome to another episode of the Granite List Live, where we discuss all things related to employee benefits and human capital. I'm Lee Dill, and we are live at the Validation Institute's Health Benefit Nation in Nashville, Tennessee, and I am thrilled to have Stephanie Koch with Hendry Marine Industries. Stephanie, thanks so much for joining me today.
Thank you for having me, Lee. It's an honor to be here.
You are being recognized in the media, or I would say the employee benefit space, as being a leader, an HR leader. Can you share the big news that's going to be released later this week?
Sure. So I was actually blown away by the fact that I was informed that I am one of the top 25 benefit leaders of the country here in the United States. Thank you. By Employee Benefit News. And we actually are going to a banquet and attending the EBN annual conference in San Diego next week. So
Yay.
It's exciting.
Yes, very exciting. And it sounds like you've done a lot to get there. So you should be proud of all you've done in the past and what you're leading into the future of carving the way into really making a change into the population that you serve.
Yeah, for me, I have worked in HR for 25 years. Mm-hmm. And up until about 8 years ago, I, as an HR leader, sat in the seat where we kept renewing our benefits and we kept having increases. And I felt like there was no end in sight. It was like that vicious healthcare renewal cycle. And about 8 years ago, I was introduced to an outside the box healthcare strategy. And initially, I did push back because I thought it was a too good to be true solution. But once I jumped into it and became open-minded, I learned about it and really dove into it. And it has become a career-changing pivot for me. Mm-hmm. And that's what's led to me speaking at different conferences all over the country. And essentially, it's my way of giving back to my HR profession and really saying, if I'm able to do this and overcome the healthcare beast, everybody else can too.
So talk a little bit about what your fears were in trusting that this kind of complicated strategy was actually going to work.
So part of my fear initially was, again, like, this seems too good to be true. Mm-hmm. We're in a reference-based pricing program. Mm-hmm. And when I heard about it, some of the initial fears were, are my employees going to be supported? Because I'm the caretaker of the employees, and that's something that as HR leaders, we are responsible for the largest asset that a company has, which is the employees. Mm-hmm. So I wanted to make sure that the healthcare plan we were going to provide was going to have the support and advocacy that the employees needed in order to really adopt the type of plan that we were offering. So part of that was to meet the team of people that were going to be essentially administering our healthcare plan, mm-hmm. understanding the support mechanisms that the employees were going to receive, also understanding that if we needed assistance and support from an HR perspective, because it seemed like it was going to be a lot more work, who was going to be there to help us?
Right.
So that's always the biggest fear, because there's a lot of companies that have a one-person HR department mm-hmm. that's supporting a lot of employees. And what we found through that discovery process was our HR team was going to get more support. The employees were going to get more support and advocacy, primarily the day-to-day questions that an employee mm-hmm. would have about their benefit plan. Mm-hmm. But this really focused on the support the employees would get if they received that ugly balance bill from a hospital.
Yeah.
And, mm-hmm. When you think about it, if you were to call one of the big carriers, mm-hmm. If somebody calls and says they have a balance bill, good luck getting any of the line items associated with the bill that they're getting. But in this case, my employees were going to receive an support and advocacy that were going to walk them through the balance bill. And in a lot of cases, as long as they met their out-of-pocket responsibilities, mm-hmm. they were going to have advocacy to help shut the balance bill down.
Oh, that's great.
There are so many millions of Americans that are in debt because of healthcare. It's medical debt, and there's those employees or people that are not getting the care that they need because they can't afford it. And that's just wrong.
Or they don't know where to go. And so you have a unique workforce where they are on the water most of the time.
Yeah, so we're a shipyard at the Port of Tampa. Mm-hmm. And we have 300 employees, and 80% of them are males. Age group is late 40s, early 50s. And, we really wanted to put a focus on how we were going to best serve our employees. Because I always say that you really have to meet employees where they're at and really understand what's going to speak to them and what is going to encourage them to want to take care of themselves.
And so, what did you find?
So, one of the things that became very evident to me going back a few years in exploring the new healthcare plan that we kicked off, and again, 8 years ago, I was at a different company. And it just so happened when I moved over to Hendry Marine, they were on the same plan that I worked with at my last company.
Okay.
So the beautiful thing about this type of plan is that we have transparency to all of our data. So it also gave me the mindset that we, HR, have the ability to make very mindful strategic decisions related to our healthcare planning. So that being said, back in 2021, we were looking at some of our mid-year data, and we saw that only 15% of our workforce were using the preventative wellness benefit.
Oh, that's low.
Very low, but of the 15%, it was primarily the dependents, not even the employees themselves. So keeping in mind the 80% male population, late 40s, early 50s, and no one or a small percent of them were using their preventative wellness benefit, we immediately knew that we had to take action. So to answer your question, we ended up bringing primary care on site to the company through a company called Walk On Clinic.
Okay.
So we started off by 1 day a week, and initially it was preventative wellness.
Okay.
And what we found was staggering is when they opened the first 3 months, we actually had 2 employees with life-threatening illnesses that had we as the employer not provided an on-site primary care resource, we don't know what would have happened.
Wow.
So it was then that we knew we were doing the right thing for the employees.
Absolutely.
But we were also really methodical about setting it up, because if we were going to bring it to the employees, we knew we had to be very thoughtful. So they don't have to clock out. They don't have to take PTO. All of their covered dependents on the plan can also come as long as they're 16 or older.
Okay.
And we also allow non-covered employees to use the benefit at no cost.
The on-site clinic
The
benefit.
on-site clinic benefits.
Okay.
So where initially was preventative wellness visits, we started realizing that as people were starting to use the clinic became a really critical part of our healthcare ecosystem. And they started becoming a trusted advocate and primary care for the employees and their family members. So we then started expanding services. So it went from preventative to blood work to sports physicals, return to school physicals for the kids 16 and older. They brought colon screenings on site. Not a, it doesn't replace a colonoscopy, but these tests now that we're able to have them administer at the clinic, there's a high percent of accuracy related to blood work and any markers for colon cancer. And people would much rather do something than nothing.
Absolutely. And if it's there available for you or to them, it's hard to look the other way. Were you requiring your employees to have a screening or a physical, or was it at will?
So part of our pre-hire process is for our employees to have a pre-hire physical. But that really isn't hitting the marks related to their overall health. So we don't require them to use the clinic, but we have over 80 employees and their family members that have now designated them as their primary care doctor, myself included.
That's great.
My son included.
Yeah.
So it has been one of the most rewarding experiences and projects I've worked on in my career, because what we've seen is more of the employees are being engaged in their health. And, we see that in the data related to the preventative wellness benefits. But we're also, when we talk about expanded services, one of the things we wanted to do was decide that part of someone taking care of themselves is to take medication on a regular basis for maintenance.
Right.
So diabetes is 10% of our population. High blood pressure, cholesterol, those are typically maintenance meds. And what we decided to do was partner with a local pharmacy.
Okay.
Once the employee or their covered dependent goes to the primary care clinic and designates themselves as a patient, that pharmacy, once a prescription is called in by our clinic, that pharmacy fills it for 90 days and then delivers it directly to the clinic on site for the employee, and it doesn't cost them anything.
That's great. Well, you're not only have a great retention tool, but you're also, helping the lives of your community.
Absolutely. And I think as HR professionals, like I said earlier, we are responsible for managing the human capital along with so many other things. But the healthcare spend is typically a second largest line item that a company has from an expense perspective. And I know now, 8 years later, as an HR professional, that we have the ability to have so much impact along with the employees' livelihoods and their families, but also the bottom line for the healthcare spend, because we have transparency to our data. And that allows us to make more strategic, methodical decisions about what lever to pull that's going to have an impact on the employees.
So you brought up data, and we talked about, things that you can't measure except for really, happiness and goodwill, retention, what you're doing for the, the community. Can you talk a little bit about what data points you are looking at and what you are measuring?
Sure. So I already talked about the preventative wellness benefit, seeing that as a huge data point and an opportunity. But even on our pharmacy spend, for example, we had or have an employee that has an illness and that requires them to have a certain injection. And what we noticed was that that medication was being billed on the medical side of our plan. And because I had previous experience working with this, we were able to take that medication, move it to the pharmacy side of our plan. We were able to get the injection site where they were getting the medication injected, agree to allow us to source the medication ourselves.
Oh.
So brown bagging it directly to the facility.
Right.
Also sourcing alternate funding. And essentially what happened with that one medication was we reduced our expense over $100,000.
Oh my goodness.
Just for that one medication.
And just by taking the time to dig in and say, what can we do?
Exactly. So when you work with an insurance advisor and a TPA or another type of company, in our case, we work with Imagine 360.
Okay.
And I've been working with them for 8 years over my last two companies. We have the ability to have access to all of our data. So we have access to our pharmacy data, our medical data, and it allows us to make very informed decisions rather than just, for example, taking a point solution and throwing it at the plan and hoping that and praying that it works.
So they're measuring that vendor solutions.
Exactly.
Utilization and commitment and savings as well.
Exactly. So another thing that we saw, I mentioned earlier, we have 10% of our population that has diabetes. And that's significant because not only does it hit the medical side of the plan, but it's hitting our pharmacy side of the plan.
Right.
So we are engaging with a whole person solution, that's going to provide coaching and support for the people that have the diabetes, but it's also going to focus on population that might have weight management issues or other issues that they want to focus on. That's going to hopefully help their mental health and drive some of those other costs down.
Well, I love what you're doing. You are definitely a leader in this space.
I
So
appreciate
thank
that.
you for your commitment and for motivating other HR leaders to, don't be afraid to try something new, because at the end of the day, you have a population to serve and you're their advocate.
We are, and that's really why I got so involved in speaking at conferences and encouraging other HR leaders to say, hey, if I can do this, you can do it too, because I was in my own way 8 years ago. And I'm glad I finally decided to become open-minded and curious and learn what actually can be done. And for a couple years, we were part of a profitable department. We had $1 million of surplus in 21 because we over-accrued for our healthcare spend.
Yeah.
We had $500,000 in 22. 23, we didn't have $500,000, but we had over 100,000.
It sounds like your accounting department got better at what they were doing too.
It's just really a matter of the healthcare plan just being managed the right way. But at the end of the day it's possible. And that is really those encouraging words that I want to share with my other fellow HR professionals.
Yeah, don't be afraid to have a positive. Because so many of them probably have negative, or, oh my goodness, we didn't know it was going to be this expensive.
Exactly. And, the increases that HR leaders are getting from the big carriers, the truth is it's unsustainable, because that's money that they're spending that could be reinvested back into the company and the employees to do something else.
Absolutely. Well, Stephanie, thank you again for joining us on
Thank you for having me.
Yeah, on another episode of the Granite List Live.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.